Good morning, good afternoon, and good evening, everyone. Welcome to AIIB's sixth annual meetings, hosted by the United Arab Emirates. The theme of this year is Investing Today, Transforming Tomorrow. My name is Luki Eko Buryanto. I am the Vice President and Chief Administrations Officer of AIIB. It is my great pleasure to introduce this high-level seminar on building resilient urban health infrastructure. The seminar is meant to reflect on countries' level of preparedness and the quality of their response to the COVID-19 pandemic. And looking into the future, the seminar will address a central question, that is, how urban centers can enhance their readiness and response to future health security threats. Our keynote speaker is Mrs. Shira Greenberg. She is currently the Chief Economist and Director of States Revenue, Research and International Affairs, and alternate governor of AIIB for Israel. Through their keynote speech, she will set the tone for the seminar. Today's moderator, President Sungman Kwon of the Korean Healthcare Industry Development Institute, will introduce our three distinguished panel members that are coming from the governments of India, the governments of the United Arab Emirates, and the presidents of CH Planning from the USA. Dear friends and colleagues, COVID-19 has caught the world by surprise and exposed a high level of unpreparedness and chaotic responses to the pandemic in high, middle, and low-income countries alike. COVID-19 has also revealed a lack of resilience of chronically underfunded health systems around the world, with overwhelmed hospitals treating COVID-19 patients and making it difficult for other patients to access care. Multilateral development banks have answered to the challenge. AIIB in particular has responded swiftly by establishing the COVID-19 Response Facility, or CRF, and providing emergency support to stressed health systems in Asia and Europe. The world has enough vaccines to fully immunize 70% of the populations by the end of 2021. But how to ensure the equity and affordability in access to vaccines remains a challenge. The socio-economic damage caused by the pandemic has reached a point where the most economies have no choice but to learn to live with the pandemic with an adequate supply of vaccines and efficient management of the transition's risk. For government, international communities, and also AIIB, it is now the time to engage in post-emergency activities to make health system more sustainable and resilient to health security threats. Already, we have many lessons learned to enhance preparedness for the next health crisis at the national, regional, and global level. One central lesson learned is that the world needs to get much better at coordinations and multilateral cooperations in fighting global threats. In early 2021, AIIB established the Social Infrastructure Departments to promote healthcare infrastructure. As the departments experience growth, other areas of finances may emerge relating to factors that affect health systems such as population aging, urbanizations, and climate change. By bringing together a panel of the fine experts, the Social Infrastructure Departments hope to identify and discuss priorities aiming at rebuilding a green, resilient, accessible, and technology-driven urban healthcare infrastructure with the participations of the private sector and the engagements of communities. I look forward to the results of the discussions and wish full success to this high-level seminar. Thank you.
Good morning to those joining us this session from around the world. I'm happy to be here with you today to discuss the importance of building resilient urban health infrastructure and to share from Israel's experience in building its technology-driven health system and in combating the COVID-19 pandemic. As is made evident by my virtual appearance today, the effects and challenges of the pandemic are not yet behind us, and high and low income countries alike are still far from their pre-COVID norms. Here in Israel, more than a year and a half after the first COVID-19 case was reported, we are exiting our fourth wave of the pandemic and have learned many valuable lessons in health crisis response and preparedness along the way. Israel's response to the COVID-19 pandemic certainly has a lot to do with the actions taken since its outbreak. However, one of the most effective steps in our pandemic response were taken more than 25 years ago. In 1995, Israel passed the National Health Insurance Law, making membership in one of the four public health funds mandatory, effectively establishing universal health care for all. Under this law, the health funds are required to offer a basic package of health services and treatments, known as the health basket, to all members, regardless of gender, age, location, income, or health status. Around the same time as the passage of this law, Israeli healthcare providers started digitalizing their patient records, and today, nearly 100% of medical records are stored digitally. The benefit of this system is that it is integrated, ensuring that physicians and care providers across the country can easily access patient information, thereby increasing the quality of the care provided to each patient as an individual over the course of their lives. Looking back to February 2020, Israel, like the rest of the world, knew little about the COVID-19 virus and the havoc it would wreak on the world economy and society. However, Israel's early adoption of digital health technologies, which began with the implementation of electronic medical records, or EMRs, has proven to be a key investment in emergency preparedness and has aided in the government and health system responses to the pandemic. Without having to rely on data provided voluntarily, policymakers and health officials were able to use anonymized data from the EMRs to gain accurate and real-time information on the numbers and seriousness of cases, which allowed for more informed decisions making when evaluating the need for lockdowns and other restrictions. Other technologies developed before and during the pandemic, such as telemedicine, big data analytics, and AI, have also been useful in supporting Israel's proactive and predictive crisis response. During the height of the pandemic, telemedicine kept non-urgent cases, including mild and asymptomatic COVID patients, out of hospitals and community clinics, thereby allowing healthcare providers to properly attend to serious cases without limiting the quality of care provided to all patients. Big data analytic tools played a role in healthcare decision-making and in informing decisions on precautionary measures. These tools have also been extremely useful during non-pandemic times, allowing researchers to access data in support of the research and development of medical innovation and improvements in patient care. By December 2020, in the midst of the third wave of the pandemic, this data proved to be essential when Israel began the world's earliest COVID-19 mass vaccination campaign. With access to a wealth of patients' information, the four health funds were able to quickly and accurately identify those deemed eligible to receive the vaccines among their patient pool. Based on age and risk groups, the health funds notified citizens of their eligibility and invited them to be vaccinated, and within 3 months, more than 50% of the Israeli population had received 2 doses of the vaccine. Not only did Israel's digital health system permit the quick and efficient rollout of the vaccine program, but it has also allowed medical officials to track vaccine side effects and efficacy, which over time informed decision-making on the need for subsequent doses. We are continuing to monitor this data and have committed to sharing it with the world in order to support the global efforts to end the pandemic. The Israeli experience has highlighted the importance of data and digital tools in health sector As countries continue to recover and build more resilient health systems, we hope that the lessons we have learned here can serve as a guide. As we know from our experience, the system must enable and encourage the flow of health information between care providers, policymakers, and other authorities in order to ensure that the system will continue to function effectively and efficiently, particularly in times of crisis. This is especially true in the cases of urban health systems, which present their own unique challenges for achieving health outcomes. This complex and dynamic ecosystem requires systematic approaches through which institutions and communities must work together towards a common goal, be it the response to a short-term crisis or the management of longer-term community health issues. The functioning of such systems is heavily dependent on the collection, analysis, and use of data as a tool for planning and delivering health services based on the actual needs of the community. Equally as important as the flow of information is the flow of the supplies needed to meet this need. Countries must build strong and reliable logistics networks in order to support the provision of care during normal times and to aid in the distribution of emergency supplies such as PPE and vaccines during crises. The MDBs can play a key role in financing the necessary improvements, helping client countries ensure their supply chains are ready to assist in response to the next crisis. It is important to know that none of the successes of Israel's healthcare system would have been possible if not for the existence of a strong network of digital infrastructures without reliable internet and mobile networks. It doesn't do a health system any good to possess advanced or even basic healthcare technologies. Countries must therefore prioritize investments in digital infrastructure and improvement in connectivity. Not only will improved connectivity strengthen a country's healthcare system, it will also support development outcomes in other sectors and lead to overall increases in sustainability, inclusively, and resilience. The MDBs can support this effort by financing digital infrastructure projects and offering capacity building and support to policymakers and regulatory authorities. In addition to this, the MDBs should ramp up their efforts to strengthen the health system in their client countries by supporting a move towards universal healthcare, financing the innovation and implementation of digital health technologies, such as EMRs, telemedicine, and big data analytic tools, and strengthening supply chains. The AIIB, with its unique focus on investing in infrastructure, has a lead role to play in this effort through the financing of the necessary supportive infrastructures across the continent. We look forward to supporting the AIIB and working together to build a more resilient Asia. To close, I would like to thank the AIIB for the opportunity and our host country, the UAE, for arranging this important session. Thank you.
I am Hun Kim, Director General of Social Infrastructure Department, and I would like to thank Ms. Greenberg for sharing with us some very crucial lessons learned from the successful response to COVID-19 by Israel. My take is, number one, the key role of universal health care to ensure all population groups have a fair chance when confronted to COVID-19. Number two, the transformative role of digital technology. The pandemic has triggered much progress in e-consultation, e-prescription, vaccine development, gene sequencing, epidemic surveillance, and availability of scarce resources such as ICU beds and personnel. And equally important, number three, is well-functioning supply chains must be in place to ensure availability of PPE, oxygen, respirators, pharmaceutical ingredients, and etc. Now, The key point here is that these dimensions require sustainable and steady investment over long term, not only at the time of the crisis. Now, having said that, let me now invite President Kwon to lead the panel discussion. Mr. Kwon has a distinguished career as a health economist over 30 years on the issues such as universal healthcare, health finances and systems, aging, and health industry. Before heading the Korean Healthcare Industry Development Institute, which is a government agency allocating R&D funds to the health sector, Mr. Kwon was professor and former dean of the School of Public Health of Seoul National University. He has held visiting positions at the Harvard School of Public Health, London School of Economics, University of Tokyo, Peking University, etc. He is also well known to international community, advising international organizations, including the IMF, World Bank, and ADB in various capacities. Mr. Kwon, now the floor is yours.
Thanks a lot, DG Kim. It's my great honor to participate in this meeting and moderate the discussions with distinguished panelists. The main theme of our panel discussion is to what is the best preparedness and response to a pandemic crisis, and there has been a lot of already discussions on the role of the infrastructure, technology, and digitalization. So today we are quite lucky to have three leading experts in this area. One from India, another from the United Arab Emirates, and also one expert from the USA. So what I'd like to suggest is that we are going to have like a 3 or 4 rounds of discussions following a key common themes related to this COVID-19. So I think you all have the bios of these key, distinguished panelists. But let me briefly introduce our panelists. We have first Dr. Sekar Bonu from India. He's the Director General of the Development Monitoring and Evaluation Office, which is also called the Niti Aayog, leading think tank in India. And also we are lucky to have a Ms. Nisreen Ahmad Abada from the United Arab Emirates. She is leading this COVID-19 pandemic crisis in the United Arab Emirates. And also we have a Ms. Chanel Hicks. She's the president of the CP Planning and in the USA. So let me start with the first question. So topic for the discussion. The first topic is that we are still in the pandemic crisis. So I'd like to ask the panelists to give comments or views on the overall assessment of the COVID-19 situation in your own country, and what is the level of preparedness, and what is the effectiveness of response for the COVID-19 in your own country. Let me start with Nisreen, and then Chanel, and Sekar Bonu. So I'd like to invite Nisreen to give your own thoughts and views on this the topic, please.
Thank you very much. A very good morning to everyone. This is Nisreen Abada from Dubai Healthcare Corporation. I'm joining you today from Dubai. So I'm here today to be part of this, and it's a great honor actually to be part of this panel of experts and leaders, and hopefully we'll be able to shed some light on lessons learned from the pandemic of the COVID-19. Well, let me start first by saying that definitely COVID-19 pandemic has taken a significant toll on the healthcare systems around the globe. We can just say that nobody was really correctly prepared for this pandemic. It has caught us by surprise. It was more of a stress test, testing our capabilities and our abilities to withstand the pandemic, which obviously required some sudden shift in the dynamics. We are lucky enough in Dubai, in the Emirate of Dubai, and I can also speak on behalf of the whole of the UAE, United Arab Emirates, is that the leadership has always had visions for innovative and quality healthcare systems on the long run. So that has helped us, and I can elaborate on that a little bit later. But overall, the first measures that were taken were a rapid response at a very early stage of the pandemic. So once it was declared by the WHO as the pandemic, there was a national declaration for a crisis within the country. All the different sectors at a multilateral, multi-sectoral collaboration started. Dubai Health Authority, and that's the corporation, started engaging with the Dubai Police, Dubai Ambulance, Dubai Municipality. We even collaborated closely with the Road and Transport Authority. We developed a small command center to start looking at how we can ensure data-driven decisions. So what happened is that we all started collaborating. Even the private and the public sector started working in solidarity together. And it's noteworthy to say that even the community was very cooperative in being compliant to the regulations and the mandates that came up during the process. It's very important to say and to highlight that with this multi-sectoral, multi-level, and multilateral collaboration, a number of institutional plans and strategies were quickly developed and implemented. Strict containment measures were in place right at the early stage of the pandemic, and which included restricting movements, mandating self isolations, even curfews at one point of time, mandating strict precautionary measures such as social distancing across the emirate. The public were not allowed to move around in the public areas and in public transport without masks, etc. So all these activities together were able to, in a way, limit the spread of the pandemic or the virus, reduce the number of infections somehow, and definitely limit the negative impact overall. If we take it from another angle, there was the economic and financial drop of during the pandemic. The governments together all worked hand in hand in solidarity to ensure that there are measures and mechanisms in place to maintain the welfare of the individuals and the society as a whole. Obviously, there were unparalleled demands on the healthcare system. I cannot just say that the healthcare system was 100% ready. No, we cannot admit that. That would be something wrong to say. Being prepared is one thing, and having the capability to be able to combat the pandemic or the crisis is another thing. Obviously, there would be in any healthcare system vulnerabilities or brittlenesses that we need to identify as we move on. So the team within the command center worked together in harmony by keeping abreast with the WHO updates and mandates, directives. We were always in a dynamic and continuous mode of evaluating the situation internally and externally around the world, exploring or evaluating potential scenarios so that we can place risk reduction measures as we moved on. So it was very important for the collaboration between the private and the public sector, and the institutional plans and strategies were really important to roll it out across the whole of the Emirate of Dubai. There were budget restraints as we moved on. The government of the UAE were very generous to put upfront budget allocations specifically to combat the virus. As it has been mentioned a little bit earlier, like issues for supply logistics, issues with personnel, healthcare professionals, trained personnel, etc. So I have to say it was a continuous process to evaluate the pandemic in collaboration across with other ministries, other government entities that were able to make us pull this through and minimize loss of lives and minimize the spread of the pandemic.
Okay. Oh, okay. Thanks a lot. This one emphasized, among others, the roles of very rapid response and the importance of a multi-sectoral approach, whole of the government governance framework. Can I invite Chanel to comment on the preparedness and the response in the case of the US, please?
Yes. So our experience was a little different. Back in February, we all went to work one day. We went home and we were told, or we had expected that we would be home for 1 week, then 3 weeks, and then we still haven't gone back, most of us here in the US. The response here very different than in other places. A lot of the response was from the bottom up. In terms of the healthcare situation, it took us time to realize what was going on. The communication was slow in the beginning, and it was left to people in each community, each state in some regards, to decide how we were going to react. On the federal level, the emphasis was on communication and on addressing how to find a cure or vaccine or how to solve the problem. But on the more local level, it was really left to business leaders and local officials to decide how they were going to react. There were limitations on what could be required by the government in each state, and even each city and town had different requirements. However, the response was a lot of it was from the ground up. And in terms of the infrastructure that was required, many of the things that allowed us to continue working, continue transport, really, we found that we had to use what we had. So my business and businesses like mine, fortunately, we have, my employees and many people have their own individual laptops or computers at home, and they were used for work. Same thing with cellular phones and things like that. In terms of our immediate response to the pandemic, the biggest and most important thing that we did here was to stay home so that healthcare providers could be there to take care of us when we needed it. In terms of PPE and other health infrastructure, people who had a job at one point during the pandemic and lost their jobs, they went home and started making masks for their neighbors. People who at one point might have worked in an office, they started driving to deliver groceries and other goods for their neighbors and to support healthcare workers. Communication was a big part of it. Leaders in places like New York and some other places stepped up to share data on the effects of the pandemic. And everyone in the country really relied on this communications infrastructure just to learn what we should be doing on a day-to-day basis. In terms of staying home and supporting healthcare workers, those of us who had other health issues, delayed some of our responses. And it was a long time before telemedicine really picked up in a big way. So there were many people, when the hospitals were full and overrun, there were many people who became sick from other ailments. Over the course of the pandemic, we got a lot better at kind of bridging that gap. A lot of innovation, again, most of it on a very local level, even person by person level to respond. So mass transit, which isn't very good in most parts of the US, became impossible. In many cases, service was stopped or halted. People started riding their bicycles or using microtransit scooters, walking to get where they needed to go. In terms of healthcare, it took probably a year in before people started using telemedicine, and our regular healthcare providers weren't working in the office. It was only the hospitals, and it was only COVID care for quite some time. Now we've learned so much from this crisis that there are changes that are going to be permanent. I think that there are very few people now who are going to work in any capacity 5 days a week for 40 hours. I think working from home is becoming the norm for many of us. And because of that, our infrastructure in our homes, our internet is being, is more important than ever. Making sure that families have access to technologies is important, just so people are able to work from home. My business centers a lot on transportation infrastructure and basic infrastructure. And we learned just how important that was during the course of the pandemic, and how those investments that we'd made in advance of COVID really came into play to allow us to be able to find new ways to work, to find other opportunities to access healthcare, and to find other opportunities to take care of each other during this difficult time. So basic infrastructure, communication, and being able to pivot and come up with new ideas on a local and individual level. Those things were really key.
Thank you, Chanel. Very important point that during this crisis situation, it gives us an opportunity to innovate, like a bottom-up or local level innovations, among others. Thanks a lot. Can I ask Sekha to comment on your experience from in India, please?
Thanks, Professor Sunwan. Greetings to all the participants from New Delhi in India. Uh, I think, as alternate governor Ms. Greenberg mentioned, the initial response based on a limited understanding about the pandemic was built around existing institutions. So it's very important for a pandemic of this size for us to be prepared for future. We have to build strong institutions, strong available digital networks, and civil society and private sector partnerships. So that was, I'll explain in stages. So we built on existing strong networks, institutions, and it's not just about health. It's a very, very fine balance in pandemic between health and economy and jobs and livelihood and food security. So how do you do this fine balance in a complex situation where you are just learning about in the early stages of pandemic, and in a extremely complex multi-tier government system? So you can understand the challenges that the top leadership must be having at that particular time. So the leadership, very, very strong, did what was the best, put lots of experts in multiple groups, tap all the wisdom that existed within the government, private sector, and as well as civil society to address the unfolding multidisciplinary, once in a century challenge, and being very agile, trying to learn and then adopt and keep on evolving. So what we are today is very different from what we are when the pandemic started. So to start with, in a large system, three-tier government, national, state, and city government, a very, very strong central leadership was required. The constitution provided for it, and the Ministry of Home Affairs stepped in and using National Disaster Management Act, brought in one of the toughest quarantines across the world, because around the time, that was what the science was saying. If you can control, if you have quarantine for a couple of weeks, maybe things would close. Then the Ministry of Health and Family Welfare constantly kept on providing the technical guidelines, constantly based on evolving sciences. What I think really helped India address a lot of challenges is the pre-existing, very, very resilient institutions that India had established for food distribution system. So we have highly digitized food distribution system up to the doorsteps of remotest village. So that was one. So this under our majority, significant of our subsidy actually goes into food security. So that was one. The other is the institutions that we had established, and highly digitized institutions which we had established for rural livelihood. We have one of the largest government-run employment generation program. So all these things put together, while the economy came to standstill, we kept taking care of the other requirements, livelihood requirements and food security requirements and so forth. And at a scale, at a mammoth scale, where we are talking about more than 1 billion people. While doing this, we started off with very, very limited testing capabilities, but over a period of time, as we talk, we have 3,000 labs, both in public sector and private sector. So the private sector responded, the public sector also raised to the occasion. But more important, the government unlocked synergies that existed everywhere. Then we had this testing while we were building on existing information stacks, and put a additional layer over it to build the information systems that are required to respond to this pandemic of this scale. For example, we had this testing data. This data from all the labs was centrally accumulated by ICMR, the Apex Medical Research Agency of India. So we had single source of information around the testing. We didn't have that single digital ID like Israel, but we are working towards it. We understand its importance, and but we were putting different information stacks. We had stack of individual ID. We called it as Aadhaar. We had different other information systems. We put a layer of it and used it and use this data to understand the emerging patterns of epidemiology of the disease, and then from a centralized response, because the centralized response also had impact on economy, we went into decentralized, much more fine-tuned, nuanced responses. Then using the digital technology capabilities, India came up with Arogya Setu app, which is downloaded by close to 128 million people, for through which all information relating to quarantine, relating to the risks of that particular individual based on his movement, vaccination certificate, all of them were provided through a single app. Then the most fascinating is, as all these things were happening, a lot of effort was put on vaccination. India homegrown vaccines, Covaxin and Covishield, we crossed more than 1 billion doses. But maybe I'll just conclude by talking about my own experience. I managed to get myself vaccinated. It was a decision that I took in the morning. I went to the website. I knew exactly where the vaccination centers were within 1 kilometer of my home. I just walked to the vaccination center. I got myself vaccinated, first dose and second dose. The waiting time was hardly 5 or 10 minutes, and everything was in a very, very clean environment. And everything was facilitated by CoWIN app, which brought again multiple stacks together, information on vaccine availability, the centers, and also built on the app individual ID, that is Aadhaar. So every vaccination was linked to the unique digital ID of individual, and which leads to certification and understanding. So maybe I'll stop here and respond, come back later on. Thank you once again.
Thank you, Sekar. I mean, you gave a good, review of the Indian case, and emphasized the role of the leadership, civil society, and especially those information data systems in in the multi-government levels, like federal, state, and the local government. Probably we can get back to that point again later, because that's a so important issue. So now let's move to another kind of theme or topic for discussion, which is, I mean, this COVID-19 crisis gave us an opportunity to rethink about the role of the public and private sector, and the collaboration and partnership between these two sectors, because we all know that facing this huge scale health crisis, public sector alone can never cope with it in terms of testing capacity, patient treatment, or PPEs. So it gave us a good opportunity to think about what is the best way, best modality for the PPP. So I'd like to ask the panelists to provide your thoughts on this role of the PPP, and what is whether PPP, whether or how PPP affected the performance of the system to respond to COVID-19 in your own country, or in general. Can you start with Sekar? Please give us your views on the PPP.
Thanks, Professor, once again. Even before pandemic, if you look at India's health sector, the provision is largely by private sector. Close to 65 to 70% is through private sector. So even before. And the nature of private sector has been very it's still evolving. It is fragmented. Close to 95% of the health facilities are uh, smaller than, let's say, 10 employees, So it is fragmented, it's across, and it's spread, and its role is much larger in distribution of drugs, manufacturing of equipment, and so forth. So in this, it was a vibrant sector, and it responded in different manner. Initially, when we stuck with this lockdown, they also suffered. The logistics were upset. The supply chains were upset. But as the quarantine started, lockdown started relaxing, they responded immensely, and absolutely the private sector respond to incentives and also the enabling environment that was already there. Within no time, from importer on many aspects, Indian industry responded and started catering to the local needs, but also started exporting. And in terms of testing, as I said, more than 50% labs are in the private sector. In terms of provision too, wherever, the richer people who could afford, they were responding to, they were going to the private sector. But I think there is definitely need for a lot more consolidation or formalization, of healthcare provision, because the smaller entities were very, very vulnerable to the pandemic shock themselves. So they didn't have the depth to withstand the pandemic. So some of the private sector actually withdrew. So that reduced the capacity of the health system. Larger private sector players had much deeper resilience to withstand. But I think this vibrant private sector, especially the pharmacies, they really provided huge amount of support. In a way, the pandemic evolving treatment protocols, they somehow through the information networks, WhatsApps and others, quickly were translated and commoditized. The access to corticosteroids, the access to blood thinners, and so forth. So they were widely available in remote villages. Preventive actions were being undertaken. We don't know what exactly helped or what are the lessons. I'm sure we'll be debating about it over next 5 years, 10 years. But I think this vibrant private sector, the pre-existing private sector across remote areas of India in terms of pharmacies, there might be some non-formal providers, but they all responded. The technology, the information system, commoditized the highly specialized knowledge into simple medical protocols, which in a crisis situation was the best option available for a lot of citizens in remote areas. So, and understanding this, government is stepping up. We now have one of the largest health insurance schemes, as you know, Ayushman Bharat. We are targeting close to 500 billion to be brought in, and this will open up huge markets for consolidation, formalization of private sector provision in India. And a government also understands that there are things that the government has to do to enable private sector, like create large stack, like we have the personal ID. So now the government is planning to have National Health Digital Mission, under which there'll be a digital ID, health digital ID for everyone. That will be a government stack. Then around that government stack, all the private sector providers can come in, share information in a secure manner. I think this technology, the insurance payment, are going to create huge enabling environment for private sector players to come in, formalize, improve their efficiency, and do a much better job next time around, if at all a pandemic strikes us. Thank you.
Shekhar, and I agree with you that the coordination between public and private sector is so important. And also in the case of India, that the new UHC kind of scheme, Ayushman Bharat, played a very important role to incentivize or motivate the private sector to more actively involved. But it's also true that this COVID-19 patients are highly infectious. So in many Asian countries, the private sector tend to withdraw from the treatment because to avoid that infections. So that is a very common issue. Can I ask Nisrin to comment on your own views on this PPP in the Middle East countries, please?
All right. So first of all, I would like to speak on about Dubai, the Emirate of Dubai in particular. Just for you to know, as in line with the leadership of the Emirate of Dubai, His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President and the Prime Minister of the UAE, and he's the ruler of Dubai, actually has always put global investment and attracting private investments into Dubai on the top agenda items for Dubai. For you to know, actually, in the year 2015, there was a release of a regulation that legislates and regulates public-private partnerships. And that just tells you that this was an opportunity to open up for new investments. There was also the Dubai Health Sector Investments Guide that was lastly updated in 2021, which highlights opportunities for investments, public-private investments and relationships based on prioritized areas for investment. It even includes the greenfield investment mandates. There's the analysis of the Dubai Clinical Services capacity planning, where capacity gaps are identified and presented for opportunities for investment. It was worth to mention that, just to give you an idea that this is again coming from the top to the bottom. It is an adopted, let's say, model or an approach in line with the top leader vision of the ruler of the Emirate of Dubai. So it is nothing really new for the Emirate of Dubai. So this has been ongoing for quite a few years now, since 2015. And but as a matter of fact, if we're going to be speaking more about what the effect of the PPP relationships or partnerships during the pandemic, we have to say that lately there has been seen growth in the public-private partnership in an attempt to take advantage of the efficiencies of the private sector, their best practices based on international standards, their technical and financial expertise and measures. So overall, there is an opportunity for different types of investments within the healthcare, with the private sector, whether at a local level or at international level, to ensure quality, accessible healthcare systems across the Emirate of Dubai. If I want to touch base particularly on the relationship of public-private partnerships with the Dubai Healthcare Corporation during the pandemic, I have to say that the relationship was very great. The collaboration was very transparent and based on mutual benefits and mutual agreements. So as most of the team and the experts on the panel do understand, that at one point of time, early in the pandemic, some of the vital and basic medical services were not being able to be provided just because of the increased surge of patients, limited resources of healthcare professionals that can attend to the patients. So to overcome that, within the partnerships, we agreed to keep non-COVID hospitals from the private side and a few from the public side to be able to maintain the provision of vital and basic medical services to the community to ensure the welfare of each individual and the society. Number two, within the partnerships, we were able to mobilize resources across both sides. So may it be human resources because of the limited number of healthcare professionals on either side, whether it's providing volunteer work and training for the personnels, whether it be even mobilization between the two sectors in terms of equipment, such as ventilators, ICU beds, intensive care unit beds, high density units, etc., etc. So I believe that the partnership had played a great role to overcome or at least to mitigate the pandemic and limit the loss of lives. Patients, there were even the scaling of the testing of the PCR COVID-19, where initially the authority, the Dubai Healthcare or corporation public facilities were the only ones conducting the testing. Nonetheless, it was rolled out to other private laboratories, which were evaluated at the beginning and accordingly approved and authorized to participate in this task. So there was a good scale up of tests where we were able to at least do 1,000 tests of PCR at the public hospitals, in addition to the other number of tests that were being able to be done in the private sector. There was also collaboration with the private sector on vaccine research. The UAE, whether the Emirate of Dubai or Abu Dhabi, they were able to collaborate with foreign countries, one of which was China and Israel, to provide support in providing the phase 3 clinical trials within the Emirate. To help the build-up of the vaccine that can be quickly provided to the community. One more thing, sorry, you want to say something? Just one last thing was the partnerships allowed us to expand on the facilities now. So we unfortunately were met with limited capacities in terms of beds, IC units, financial resources, human resources, etc., and even quarantine and isolation facilities. So the collaboration and the understanding between the private and the public sector was very, very, very beneficial on that. And it was a very, very smooth journey and process for collaboration.
Okay, thanks a lot. You gave us a good cases of the successful collaborations between public and private sector in various areas like research, testing, treatment. Okay, let's move to the experience of the US. Chanel, please.
Yeah, so our experience here was a lot different than usual. Here in the US, we do not have universal healthcare. However, for COVID, very early on, healthcare for COVID testing was funded by the government and was free, and it remains free now. So that's one of the few things that anyone can get a vaccine without paying. In terms of hospital capacity and even delivering the vaccine, initially a lot of that was done with the help of the U.S. Military, our volunteer community-based military built hospitals, set up vaccination centers, and made all of that free. The other big thing that where the U.S. government really stepped in to help was providing funding for the research for vaccines, and basically paying for the vaccines before they were developed. They paid the private pharmaceutical companies to develop these drugs on without knowing whether or not they were going to be successful in what time period. One of the biggest parts of the collaboration between the public and private sector was in the National Institutes of Health, again, providing information, providing real data and real information to the community so people could make their individual decisions about how they wanted to conduct themselves, staying at home, whether and when to get a vaccine. Those are all very, even now, they tend to be choices at a very individual level, and the government is helpful in providing accurate information. The biggest thing that I have seen here as a business owner and as a member of my community is that the US government really provided funds to fuel our economy, providing support for families and individuals and also businesses so that people could continue to have an income, could continue to survive and do the things they need to do, and also to help mitigate serious mental health issues and prevent what could have been a very serious civil unrest problem here as people dealt with mental health issues, being at home, being away from work, and that sort of thing. And even now, the emphasis on mental health is something that the public sector, through education and information, and the private sector by providing mental health support services, are really working through.
Okay, thank you. Because I agree with you that the PPP is not just for the PPP, the service provision. Okay, it's also very important in the areas of vaccine research and development, or economic rescues to support the business, revitalize the livelihood of a country. Thank you. So let's move to the third topic. Now, this session, this webinar, is a part of the event in the Asian Infrastructure Investment Bank. Then we learned a lot of lessons from this COVID-19 crisis, and we know that it's not over yet. And even if this crisis is over, the pandemic crisis will continue in the future. And it might be, this COVID-19 might be the beginning of the series of next pandemic. Then what should we do? And then what is the role of the multilateral development bank to increase the preparedness and strengthen our response system to the future, or I mean, not just current, but also future pandemic crisis? Because one of the key lessons of this current COVID-19 is that we should increase our investment in the healthcare system, increase our investment in the preparedness and response. So please, I'd like to ask the panelists to comment on what is the role of this multilateral development bank, and what would be the specific most important areas for these MDBs to invest to strengthen our capacity. So can you start with Chanel? What do you think?
Sure. I think that investments in basic infrastructure are critical. Transportation, clean water, environmental resiliency in the face of sea level rise are all very important, because our healthcare system, our hospitals, I think we learned through the pandemic, don't exist. The hospital exists within the walls, but we have to be able to get there. We have to be able to, in a crisis, healthcare is where we need to support healthcare, but we need to be able to get transported there. We need to have systems in place so that people can work at home, so they have decent internet connectivity, decent communications and phone connectivity. So I would suggest that basic infrastructure is so critical to facing future healthcare crises.
Actually, sorry, I'm working in a public agency, and there's an announcement at the building level. So hope that
it's okay. But that's really what I mean. I really think that basic infrastructure, transportation, those are the things that are so critical.
Okay, can you move to the ask the SECA to comment on this topic?
Especially in post-COVID era, when countries are coming out of COVID, and because of both health needs and economic needs, the fiscal situations have been stretched. Debt to GDP have increased, and so in this context, there's no question that there's huge need for additional financing. But I think it has to be in a different modality. Normally, when MDBs fund, they fund infrastructure projects, especially in social sectors. They take time. So if you look at cash flows, it might take 5 to 7 years time before that whole fund flow. I think the urgent need is financing, cheap financing, long-term financing, both to public sector and also to the private sector, because large part of health infrastructure and services are provided to private sector. So when MDBs try to fund private sector, the risks are much higher, and the MDBs would like to have risk-adjusted costs, which probably will make many of the projects unviable. So I think what is required is for MDBs to really introspect and figure out how to fund projects through private sector, but managing the risk in a more efficient manner, by creating the right credit enhancement products, and figuring out some financial intermediaries with the government, where the government also doesn't assume the whole debt on its balance sheet, because fiscally, I don't think it's possible for governments to assume debt given the current fiscal situation. So clearly, there's a huge need. And then IT, I'm not sure, because IT will depend upon the telecom policies. There's a vibrant private sector. But where I think the MDBs can play is to support the government to come up with stacks which no private sector can provide. For example, in India, the payment system, it's the government which has created that huge stack, which connects various banks with various merchants. And it's small payment providers have come and have created rest of the ecosystem. So those are things which there are few things which only government can do in IT. So those are where markets don't respond. So those are the areas one should identify, and also figure out which are the global best practices which can fit into the context, political, economic context of that particular specific country, and provide that type of technical assistance. Finally, I think when pandemic came in, from the government side, I could see that within over last 2 years, I think probably I was not in office for just 4 weeks time, which also included around 10 days when I had COVID, 10 to 15 days when I had COVID. So but what I have realized is that most of the development partners have also withdrawn, including multi-development banks. Around the time when you really need their support, they are not here. So, as you talk about building resilient future, I think the MDBs should also rethink. You don't have if you don't have local presence, you want to be highly efficient. Is it one really needs to introspect? I stop here. Thank you.
Thank you. I mean, that our colleagues from the US and India emphasized that the role of the investment in the big infrastructure, because health sector is part of the big social structure, including the like transportation, climate change, urban design infrastructure. Basically, also the topic of this webinar is building resilient urban health infrastructure. And SECA also emphasized that the importance of the MDBs in increasing investment in the area where there are like huge uncertainties, such that the private sector are reluctant to invest. So those are all critical lessons. And also SECA mentioned that a bit critical view that MDB should help those countries when they are really in need of help. So it's a good point. Nisrin, ask your views on this role of the MDBs.
Definitely. Thank you so much, Professor Kwan. Well, I believe, if I may, first of all, highlight a couple of roles of the MDBs. Number one, I believe they need to support the development of a program to support the equitable access of the COVID-19 vaccine worldwide. We have seen over the past year that the vaccine has not been equally distributed across the whole world. There are countries who were able to get hold and grab of the bigger quantities. Other countries, especially the developing and underdeveloped countries, they're still lacking on that, which actually imposes a threat across the whole world. So that is one thing that definitely I believe MDBs may be able to work on. Number two is medical assistance schemes across, again, the developing countries where it may be needed. I'm sure this might be one of the items on their agenda. When it comes to Dubai, support of MDBs is very much welcome. Different projects that, again, will relate to the pandemic response or the pandemic crisis. But I would like to highlight a very important point before I move into the different examples, is that usually we tend to look at the crisis management during and after the event. Now, the thing that we need to start working on is to proactively start dealing with or exploring what risks can come up, what resources are maybe required, what policies may be required to meet a pandemic and to be well prepared for an upcoming crisis or event, whatever it be, maybe it's a pandemic or any kind of other crisis event. Our systems in general are brittle. We have to admit that there are vulnerabilities, but if we work proactively on focusing and identifying those small defects or small errors and try to rectify them as we go and adapt, that is the key to not having to be bombarded with the big shock of the crisis when it happens. So at Dubai level, I believe that the multilateral development banks can play several roles in developing or in supporting at least the development of a few of very strategic projects. First of all, number one is if they can support the development of communicable diseases, surveillance, research, surveillance, and detection systems that are enabled with artificial intelligence. That would be very good to be able to predict and be proactively prepared for any future pandemics. So that is one infrastructure that needs to be looked at. Another is we as Dubai, and in line with the leadership of the vision of the leadership, we're working towards now creating a central laboratory, which is going to be a state of the art with cutting edge technologies that would be located in Dubai, but our target is to have it accessible to the whole region actually. Focusing on virology because of the current situation and definitely other different tests. So primarily it will serve the region, but down the road we would love to have it as an extension or a reference laboratory to the WHO unit. So I'm not sure if this is the right way to tackle it or not, but I'm just trying to highlight the very directly the projects that we would love to have MDBs support on. There's a few more. Sorry,
Sister,
Dr. Kwan.
it's time to wrap up, please. Yep.
Yes. Just very quickly, without much explanation, preventive medicine delivery system models is very important to moving forward. It's not just about treating patients. How many times do you treat patients? It's more about focusing on outcomes. So the more the outcomes are improved, the less you're seeing your patients and the patients are better, and the costs of healthcare or the burden on the healthcare economy is less. And one last thing is the chronic disease management delivery systems. The population within Dubai within Dubai Emirate is more for an aging population, so there's prevalence of chronic diseases, which can be, a high cost running it down the road. So this is another area that can be explored. Thank you, Professor Kwan, and
Thank you.
Apologize for.
Yep. Thanks a lot. You mentioned the importance of the vaccines, which we all know is a game changer, and also the importance of the surveillance systems and communicable disease control. Okay, I think it's time to move to the Q&A, although it's running a bit behind the schedule. But if there are some questions from the audience, please. But in my screen so far, I haven't seen any specific questions from the audience yet. Do I miss anything? Okay. So, yeah, so far I haven't seen any. Oh, okay, there's one question. The US was rated before pandemic at the top of the preparedness for health crisis, but it turned out that it was not the case. How could be explained, and what went wrong? Let me check another one. How can increased funding for healthcare sector be sustained once the pandemic is over? What is the sentiment in India and the UAE? So I think that the first question, I think I'd like to ask Charnel to answer.
Yeah.
And also for the question on the sustainability of the funding in India and UAE, I think Sekha and Nisran can answer, but please limit your answers in 2 minutes, please.
Of course. So I can't speak on behalf of the entire U.S. health system, but I can give my observations on what I've seen and what I'm still seeing here in the U.S. So unlike many other places, well, I can just tell you, in the pandemic, I was watching TV and saw how there were places in Asia that were handling the pandemic by really making sure that people did quarantine and that people were taken care of right away. Here, we never had curfews, and it's not something, the strict requirements are something that we just wouldn't we just wouldn't tolerate it. And so the outcomes were a little worse than they might have been had we had a different system. The way even today, people aren't restricted in what they can do, but we're in a situation now that there is a vaccine and it's available for most Americans, that we call it a pandemic of the unvaccinated, right? So much of the illness was happening in areas where people didn't follow the protocols, people didn't listen to the National Institutes of Health and the advice that were given. And so was the US healthcare system somewhat prepared? Yeah. Were people willing to follow the guidance within the range of freedoms that we had? Many people were not prepared to follow that guidance, and there were dire consequences.
Okay.
And there still are.
So sorry. Sekha first, and please 1 minute, please. Sorry.
So the government is very, very committed to increasing the share of investments, government public investments in health sector, and the health policy clearly articulates, and the central and state governments both are deeply committed. So now I think where does this funding come? India has to have close to double-digit growth rate. There are a lot of economic reforms that are undertaken for post-COVID world to increase the growth rate. The third part is reforming so that we get more out of the investments that we are undertaking in health sector. So that is where I think Ayushman Bharat and others would play an important role. And we understand the critical role digital technologies are going to play. So there's a National Health Digital Mission. All put together, I think there'll be sustained increase in funding and also better use of the public expenditures. Thank you.
Thank you. Nisran, please, 1 minute, please. Sorry.
Okay. So I guess my question is the third one about telehealth. Telehealth and telemedicine. Okay, it's worth noting that again, telehealth, telemedicine was in line with the vision of the leaders. So this has always been existed. We have a telehealth services standards, regulatory standards that was rolled back in 2017, updated in 2019. We do have quite a number of telehealth and telemedicine smart applications, artificial intelligence solutions currently going on in the DHA. Nonetheless, it's worth mentioning that some of them are not at the most mature level. And moving forward, we would love to develop it more and roll it out across not just the Dubai Emirate. We would like to roll it out across the whole of the UAE. Just to mention them without any details, unless someone would like to have any details, you can always email me. We have the Doctor for Every Citizen initiative, which is a telemedicine consultation through video calls and on smart applications, free of charge, especially for COVID patients and non-COVID family consultations. We have what's called RoboDoc, which is a robotic teleconsultation booths, particularly used for emergency settings. We have the public surveillance platforms such as Hasana. We have Nabid, which is an Arabic word translated as a pulse in English, which is a analysis and network backbone for integrated Dubai health. So I can keep going on and on and on. We have a smart robotic pharmacy in one of the hospitals. So as a matter of fact, all I would like to say and end this with is that we're very lucky in Dubai and the UAE, is that because the vision of the leaders right from the top of the government and the ruler of Dubai has always ensured that innovation and quality and innovative technology is embedded in the cornerstones of all projects carried out in service of the community and the society. Thank you very much.
Okay, thanks so much. I think that the key lesson from this COVID-19 pandemic is that we should increase our investment in our healthcare system, in the preparedness and response system to the pandemic. And our goal is to build back better, right? Build back better. And this crisis gives us a good opportunity to strengthen our weaknesses and improve. So in that sense, I think especially in the context of this MDBs, investment in an infrastructure and in that sense, IT and digital health is I think one of the most important area for investment, because this digital health not only increase the efficiency of our healthcare system, but also equity in access to healthcare. So digital health and also this kind of paradigm change is one key area for us to think about, and also for MDBs to think about, and also increase the interconnectedness in the investment in health infrastructure or investing in other infrastructure, because pandemic is not just a health crisis, it's broad social crisis. So we need a good collaboration between health and other sectors. Over. So I'd like to ask, hand over to DG Kim. Thank you.
Thank you, Mr. Kwon and panel members. Now it is an honor for me to wrap up this session by summarizing the important experiences shared by our panelists and our keynote speaker. I think there are broadly three areas. First, on the effect of the pandemic. The COVID-19 pandemic has massively disrupted health system and economic system around the world, regardless of income levels. And we know that health systems were already fragilized by years of underfunding and the emergence of the new challenges, such as aging, rising chronic diseases, and sharp cost increases in the system, and shortages of healthcare workers. And these have become evident through pandemic. And second area is that on the pandemic is an opportunity, as our speakers repeatedly mentioned. The pandemic has served as a catalyst for change because we have seen wide implementation of telemedicine. Suddenly, telemedicine is a popular word, and rapid development of vaccines. Vaccine usually took years, and excellent cooperation among researchers in different areas. And however, we know that what is needed are a paradigm shift and a systemic change, not just a small incremental steps. So we hope we don't forget all these lessons once this pandemic comes to a final stage. The third is about the future. This is most important. What is required from decision makers, care providers, and civil society to build resistance? This is for the future. I think there are roughly six action points here. Action one, we should strive for a universal health care. This agenda should not be forgotten because of the pandemic. To ensure all population groups have access to care when it is needed, we need universal health care. I would suggest that this means expanding health insurance and tax-funded health systems, and reinforcing the role of primary health care, low cost, but this is important, primary health care, to ensure healthcare services are integrated and continuous. And action point number two, we need revamp global governance. Somebody mentioned the equitable access to vaccine. So we need to strengthen institutions to ensure effective multilateral cooperation and coordination at country level and the regional, such as ASEAN, and also global level. To start with WHO, and G20, G7, and multilateral development banks. And increased cooperation is absolutely needed, and especially to ensure fair access to vaccine and timely and proper allocation of funding, multilateral bank funding, and testing material and tracking methodologies. And action three, we need to improve surveillance of health security threat, ensure multi-sector collection of data to preempt threat. So here we need to pay more attention on the concept of One Health and the relation between animal health and human health. Now, action number four, establish a conducive environment for private sector participation. Was mentioned again several times. Now, health system, public sector alone cannot handle, especially in service provision, digitalization, and care innovation. And action number four, we must accelerate the digitalization of the health sector. Professor Kwon just mentioned, for equity also, to increase its resilience and improve health care effectiveness. Telemedicine, electronic medical records, drug and vaccine development, assisted diagnostic, and AI and big data. All these are becoming important. Now, this must happen by paying much attention to standardization, integration, and interoperability of ICT to avoid creating ICT silos in healthcare system which don't communicate to each other it will be a disaster. Action number point five, we must invest in human resources for health. Health workers must be motivated to prevent low morale, depression, and overstressed workers. We have seen it. Health is a labor intensive sector, and digitalization and robotization, which are the future, but will not fundamentally change the labor intensive nature of the health sectors. In particular, I would say doctors are generally usually available, but this is not the case for nurses and caregivers in most countries around the world. So to address these challenges, appropriate incentive structures need to be in place to attract and retain healthcare workers. Now, in summary, through the painful experience of the pandemic, we learn what transformative measures are needed to fix and rebuild, build it better, Professor Kwon mentioned, our health system. And then, after all, it is a largely a political will of the government and leaders and society at large to make a decision to bear the cost of rebuilding. So finally, I would like to express my sincere gratitude to keynote speaker, Vice President Luki, and our distinguished panelists who have ensured a productive and successful webinar. My full appreciation also goes to my team behind the stage to make this seminar successful. And AIB and SID in particular are eager and committed to assisting our developing member countries to learn from the lessons and adopt the recommendation that come out of this webinar. With this, thank you very much.